Welcome to RevMD's Sex Bites podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Farideh, nurse practitioner here at RevitalyzeMD.
Today, we are going to talk about Kegels and all the benefits and whether you're doing them right and do they work.
So ladies, we've heard about Kegels probably for many years, right?
Many years, yes.
Even as a young woman, my mom would say, do your Kegels. Men, probably a newer concept for you guys. But if you've looked up how to last longer, how to have stronger erections, you may have come across Kegels.
Kegels for men. It is a new concept for men and not new for women, but women have been familiar with them, but does it really work? So again, if you have a vaginal delivery, they're definitely telling you to do Kegels. What are they suggesting if ever you go into the gynecologist with urinary incontinence complaints? Are you doing your Kegels?
Strengthen your pelvic floor. Do pelvic floor exercises, which are Kegels.
Are you doing them right? So what's a Kegel? Like, we're strengthening our pelvic floor. And so it's simple. Like Farideh just kind of simplified for me, is you're just holding your urine in. So like you're midstream and you're holding, or you're trying to hold in gas, or you're trying to, you have to go to the bathroom, but you can't go just yet. So just
hold it all tight.
Pull on your floor. So it's basically contracting and up. Right now, I can do one right now. Yeah. I'm doing one right now.
Doing them right now? Yeah. Nobody even knows.
Nobody even knows. But the big thing is you don't want to use your abdominal wall. You don't want to do an abdominal contraction or a buttock contraction. You want to just basically strengthen and pull up and hold your pelvic muscles. But there's short ones and there's long ones. And
you should do a combination of them.
You should do a combination. So if you're going to hold it, pull up and in and hold it. And again, I'm doing it now, but you don't see me, moving around, because you don't want to use your butt or use your abs as the whole movement. Obviously they're going to move a little bit when you're doing them. Yeah. But short ones, you're going to do that. You're going to hold it for 1 or 2 seconds. Long ones, you're going to hold it for 5 or 10 seconds.
Yeah. So with Kegels, you're going to do a series of them. So you're going to do a couple short, wait a minute, do a couple longer, wait a minute, do a couple short. So you're going to kind of do a HIIT workout.
Yes. And the issue is they basically say, studies will show anywhere from 25 to 75%. That's a big variability on whether they work. But the issue is that you got to do them on a regular basis. And you're not talking about just a series like that. You're talking about 5 shorts, 5 longs, 5 times a day on a regular basis.
Yes. The studies were saying 5 times a day. That is a lot when you think about it.
I think that's great.
Most people can't even get to the gym 1 time a day.
Yes. Well, I think if you have severe urinary incontinence, you might invest in that kind of time frame because you're trying to change it, or moderate or something affecting your life. You're going to try and do it so that you can make an improvement. But I haven't heard a lot of good things from women regarding just straight up Kegels, like us contracting muscles. Like I haven't heard that solve the issue fully.
No, it may help some. So some women who don't have severe incontinence, or men with severe incontinence too. If the muscles are weak and you're constantly using them, right? They're muscles. What do we need to do with muscles? We need to work them out, and we need to work them out frequently or the muscle weakens. So you have to do them often. You have to do them frequently. And then a lot of times you have to push the muscle beyond the point of fatigue. That is a very hard thing to do with Kegels, to Kegel and hold tight enough and long enough to hold it past that point of fatigue for it to improve.
This is one of the reasons why we have an EMS device for the pelvic floor called V-Tone that will push it beyond that fatigue level. And so it's like a Kegel on steroids.
Kegel on steroids.
Farideh will always say Kegel on steroids. That's the issue. Yes, you have to do it on a regular basis, do it consistently. And I think that's hard for people to do. And I think that if you have mild incontinence or you just have had a baby, maybe that, works. But we see a lot of perimenopause, menopause with incontinence, and we do more medically based treatments. And we will talk about some other things that are maybe even a little more effective for incontinence in the future, like a, kind of yoni ball, vaginal kind of tightening weightlifting.
Yes. Or Ben Wa balls. They have been around for centuries for pelvic floor tightening and vaginal tightening. Same concept of the yoni ball.
The yoni ball. So like something that you're taking into the vaginal and tightening it up. And so it does other things like, improve blood flow and sensitivity. And so it has other benefits as well. And, the weightlifting is a new thing that you can see on the internet, that vaginal kung fu, so.
That's interesting. You're going to go down a deep, dark hole there.
Well, we are
have fun.
No, you're going with me. You're going with
I'm going with her, guys.
Yes.
Another one of these journeys we're going on together.
Oh, yeah. No, this will be like one of our future podcasts where we're doing the non-traditional, at least the things we don't hear about all the time. So, but for men, and again, officially the Kegels have been around since like 1948 with some gynecologists that kind of came up with the way back. And again, you just got to do it on a regular basis. But then Kegels for men is a new concept. I have heard this too. And then we went ahead and searched and saw that if you're having trouble with premature ejaculation, that this is something that can help. And so that's why it is, and stronger erections too, because it's improving blood flow. But if you think about it, reasons why maybe men have weakened pelvic floors versus women, because obviously having children is one issue, but also straining. So if you have constipation, that's one thing. If you're holding your bladder, prostate surgery would be another reason. If you had any trauma, persistent coughing. So there's lots of reasons why. And if it starts to, like if you're straining all the time and you're constipated and it weakens, then you have to strengthen it. And so if you're not, some of that premature ejaculation or weak erections might be from this.
The best way to kind of figure out what muscles are used is like Dr. Durst said earlier. So when you are using the restroom and peeing next time, try to stop your urine stream. And those muscles that you are utilizing are the muscles you would use when doing a Kegel.
So that's your test.
There
Do you
you
have
go.
weak pelvic floor?
Can you
or
stop
not?
your flow?
And if you can't stop your flow, then you have a weak pelvic floor. And so that if you do the Kegels and it improves, and then it improves your, premature ejaculation, then it makes you last longer, then you have your answer, right?
It was successful.
Yeah. And so I think that's the new part for men. So again, I think that's kind of Kegels in a nutshell. No pun intended. Yeah.
In a nutshell.
So, in a nutshell, from yoni eggs and
Ben Wa balls and
vaginal
V-tone, vaginal kung fu.
Yeah.
She's taking me on this journey, guys.
So
apparently we're going to be able to lift coconuts.
Yeah. So, I mean, again, this is something that has been going on from ancient times, supposedly. So we're going to learn more about it and bring it to you. So if you've had any experience with any of the above, if you've had great experience with Kegels, we'd love to hear about them. If you haven't, we'd love to hear about them. We have lots of medical-based services and treatments that can improve that, improve because Kegels haven't worked for our patients, but we'd love to hear more. And again, we're willing to deep dive into anything for sexual wellness because we're here to revitalize your look, your health, and your sex life.
Thank you.